What's up everyone, and welcome back to Healthy Habit Guide. It's Evans, and today we're diving into a topic that touches so many lives, breast cancer. We're going to cover everything from what breast cancer actually is, to the risk factors you should be aware of, prevention strategies, how it's diagnosed, the latest treatment options, and what life after treatment or survivorship looks like. My goal for this video is to provide you with clear, reliable, and comprehensive information. Whether you're here for yourself, a loved one, or simply to educate yourself, you're in the right place. So, before we get started, if you haven't already, please hit that subscribe button. It really helps the channel grow and allows us to bring you more content like this. And hey, while you're at it, don't forget to give this video a thumbs up if you find it helpful. Drop a comment below with any questions or topics you'd like to see covered in the future. And share this video with anyone you think might benefit from it. Spreading knowledge is a powerful tool, especially when it comes to health. All right, are you ready? Let's get into it and explore the multifaceted world of breast cancer together. So, let's start at the very beginning. What exactly breast cancer? At its core, breast cancer is a disease where cells in the breast tissue begin to grow out of control. Normally, our body's cells grow and divide to form new cells as the body needs them. When cells grow old or become damaged, they die, and new cells take their place. However, sometimes this process goes wrong. Instead of dying, damaged or abnormal cells continue to divide and multiply when they shouldn't, forming a mass of tissue called a tumor. Not all tumors are cancerous. Benign tumors don't spread, but malignant or cancerous tumors can invade nearby tissues and spread to other parts of the body, a process called metastasis. The breast itself is a complex structure, primarily made up of lobules, ducts, and fatty and connective tissue. Most breast cancers actually begin in these ducts, which is known as ductal carcinoma. Others can start in the lobules, termed lobular carcinoma. Understanding where the cancer starts is crucial because it can influence its behavior and how it's treated. One common type you might hear about is ductal carcinoma in situ, or DCIS. While DCIS isn't life-threatening on its own, it can increase the risk of developing an invasive cancer later on, so it's often treated. Then there's invasive ductal carcinoma, IDC, which is the most common type of invasive breast cancer. Understanding these subtypes allows for a more personalized approach to treatment, which we'll definitely talk more about later. All right, now that we have a foundational understanding of what breast cancer is, let's talk about risk factors. It's super important to remember that having one or even several risk factors doesn't mean you'll definitely get breast cancer. However, knowing these factors can help us make informed decisions about screening and lifestyle. One of the most significant non-modifiable risk factors is simply being a woman and getting older. Genetics also play a crucial role. Perhaps you've heard of the BRCA1 and BRCA2 genes. These mutations can be inherited from either parent. Beyond BRCA, there are other inherited gene mutations linked to breast cancer risk, like PALB2, TP53, PTN, ATM, and CHEK2. Speaking of family history, this is another key risk factor. Hormonal factors throughout a woman's life can also influence breast cancer risk. Factors related to longer lifetime exposure to estrogen include starting menstruation at an early age, experiencing menopause at a later age, never having children, or having your first child after age 30. Finally, let's touch on lifestyle and environmental factors, many of which are modifiable, meaning we have some control over them. Understanding these helps us focus on prevention, which we'll cover next. Now, for some empowering news, while we can't change some risk factors like our genes or age, there are definitely proactive steps we can take to help lower our risk of developing breast cancer. One of the most impactful strategies is maintaining a healthy body weight throughout life. Achieving and maintaining a healthy weight involves a combination of a balanced, nutritious diet and regular physical activity. Aim for plenty of fruits, vegetables, whole grains, and lean proteins. Speaking of physical activity, getting regular exercise is a powerful preventive tool. Numerous studies have shown that women who are physically active have a lower risk of breast cancer. Limiting alcohol consumption is another crucial step. Regular screening is paramount, not strictly as prevention of the cancer itself, but as prevention of advanced disease through early detection. Mammograms are the cornerstone of breast cancer screening. Clinical breast exams by a healthcare provider and breast self-awareness Knowing what's normal for your breasts and reporting any changes are also important components of a comprehensive screening strategy. For individuals at significantly increased risk, perhaps due to strong family history or known genetic mutations like BRCA, more intensive prevention strategies might be considered. Breastfeeding, if you're able to, has also been shown to slightly lower breast cancer risk, especially with longer durations. Chapter 4. The path to diagnosis. Early detection is key. When it comes to breast cancer, early detection truly can be a lifesaver. Finding cancer when it's small and hasn't spread significantly increases the chances of successful treatment and long-term survival. It usually begins when a screening test, like a mammogram, shows an abnormality, or when a woman or her doctor finds a lump or other concerning change in the breast. Symptoms to watch out for include a new lump or mass, swelling of all or part of a breast, skin irritation or dimpling, breast or nipple pain, nipple retraction or nipple discharge other than breast milk. The primary tool for breast cancer screening and initial diagnosis is the mammogram. If a screening mammogram shows a suspicious area, or if a woman has symptoms, a diagnostic mammogram will be performed. If a mammogram reveals a suspicious area, the next step is often a breast ultrasound. Ultrasound uses sound waves to create images of the inside of the breast. Importantly, ultrasound is often used to guide a biopsy needle to the precise area of concern, ensuring an accurate sample is taken. The definitive way to diagnose breast cancer is with a biopsy. This involves taking a small sample of breast tissue or cells from the suspicious area, which is then examined under a microscope by a pathologist. Once a diagnosis of breast cancer is confirmed, further tests are usually done to determine the cancer's stage. All this information is vital for planning the most effective treatment strategy for each individual patient. Chapter 5. Navigating treatment, options and approaches. Receiving a breast cancer diagnosis can be overwhelming, but it's important to know that there are many effective treatment options available today, and treatment plans are increasingly personalized. The choice of treatment depends on several factors, including the type and stage of the cancer, its hormone receptor and HER2 status, the patient's overall health, and their personal preferences. Surgery is a common first-line treatment for most types of breast cancer. The two main surgical options are lumpectomy, also called breast-conserving surgery, and mastectomy. A lumpectomy involves removing only the tumor and a small margin of surrounding healthy tissue, aiming to preserve as much of the breast as possible. It's usually followed by radiation therapy to destroy any remaining cancer cells. Mastectomy is the surgical removal of the entire breast. Radiation therapy is another cornerstone of breast cancer treatment. It uses high-energy rays or particles to kill cancer cells or stop them from growing. Systemic therapies are treatments that travel through the bloodstream to reach cancer cells throughout the body. Chemotherapy is one type, using drugs to kill fast-growing cells, including cancer cells. Hormone therapy, also called endocrine therapy, is highly effective for breast cancers that are hormone receptor positive. Targeted therapies are drugs that specifically attack cancer cells with certain characteristics like the HER2 protein. These precision medicines often have fewer side effects on normal cells compared to chemotherapy. Chapter 6. Life after treatment, survivorship and ongoing care. Completing active breast cancer treatment is a huge milestone, but the journey doesn't end there. Follow-up care is absolutely crucial during this time. This involves regular checkups with your oncology team to monitor for any signs of cancer recurrence, manage any long-term side effects of treatment, and maintain your overall health. The emotional and psychosocial impact of a breast cancer diagnosis and treatment can be profound and long-lasting. Many survivors experience a range of emotions, including relief, anxiety, fear of recurrence, sadness, or even a sense of being adrift after the intense period of treatment ends. It's important to acknowledge these feelings and seek support. Taking care of your mental and emotional well-being is just as important as your physical health during survivorship. Lifestyle adjustments play a significant role in long-term health and well-being after breast cancer. Many of the same healthy habits that help prevent cancer can also help reduce the risk of recurrence and improve quality of life for survivors. Some survivors may also need to manage long-term physical side effects of treatment, such as lymphedema, chronic pain, fatigue, neuropathy, or changes in sexual health or fertility. Fear of recurrence is a very common concern among breast cancer survivors. Open and ongoing communication with your healthcare team is vital throughout the survivorship phase. Embracing survivorship is about moving forward, focusing on wellness, and living a full and meaningful life after cancer. Chapter 7. The cutting-edge research and future directions in breast cancer. The landscape of breast cancer research is incredibly dynamic and constantly evolving, bringing new hope and improved outcomes for patients. Scientists and clinicians around the world are working tirelessly to better understand the complexities of this disease, develop more effective and less toxic treatments, and refine prevention and early detection strategies. One of the most exciting areas of current research is immunotherapy. This approach harnesses the power of the body's own immune system to fight cancer. Personalized medicine, also known as precision medicine, continues to be a major focus. It involves tailoring treatment decisions based on the specific genetic makeup of an individual's tumor and their own genetic profile. Another rapidly advancing area is the development of liquid biopsies. Imagine being able to detect cancer or monitor its response to treatment through a simple blood test. Researchers are also constantly working on developing new drugs and refining existing ones. Clinical trials are the engine that drives this progress. Finally, there's a strong emphasis on improving the quality of life for breast cancer patients and survivors. The future of breast cancer care is bright, driven by innovation, collaboration, and a relentless commitment to turning the tide against this disease. Every breakthrough brings us closer to a world where breast cancer is consistently preventable, detectable at its earliest stages, and curable. And that brings us to the end of our deep dive into breast cancer. While we covered a lot of ground today, from the fundamental biology of the disease and its risk factors, all the way through to prevention, diagnosis, the array of treatment options, the journey of survivorship, and a glimpse into the exciting future of research. My sincere hope is that this information has been clear, helpful, and empowering for you. Knowledge is such a vital tool when it comes to our health, and understanding breast cancer better can help us take proactive steps for ourselves and support those we care about. Thank you so much for watching, for investing your time to learn with us here on Healthy Habit Guide. Your presence and engagement mean the world to us. If you found this video valuable, please give it a thumbs up. It really helps other people find it. Stay informed, stay healthy, and we'll see you in the next video.